Why did Eleanor feel dizzy just standing up to grab the TV remote? And why is Arthur searching for his glasses that have been right there, on his forehead? It's easy to dismiss little things like that as just getting older, but sometimes they're signals of serious health issues. Today, we'll look at 7 of the most common health conditions affecting seniors. How can you spot the warning signs early? And what should you do to make sure you don't miss them? You might be surprised to learn which symptoms we often overlook. After age 60, the body starts to show its age. The immune system weakens, muscles become less flexible, and bones become more brittle. Even a common cold can turn into serious complications. But most importantly, illnesses can present differently. What seemed minor in youth could be the first sign of trouble in old age. Knowing where just getting older ends and an illness begins. That's the key. Hypertension, the silent killer that makes no noise. Hypertension is when blood pressure is consistently above normal. But the problem is, people often don't feel anything. They walk around, work in the garden, complain about the TV, while their pressure is sky high, maybe around 180. That's because the body gets used to the high numbers and doesn't send immediate signals. In seniors, hypertension often shows up as headaches, especially in the back of the head or temples, a feeling of heaviness in the head, ringing in the ears, or even a sound like being underwater, flushing of the face or chest, rapid heartbeat, irritability, sweating. Many people blame it on the weather or just being stressed, but often it's a blood pressure spike. And the most dangerous part? Hypertension damages blood vessels in the brain, kidneys, and heart. Any day could become their last if they don't know what's going on inside. Example: Eleanor complained of dizziness and nausea in the mornings. She took a stomach pill, but it didn't help. Her blood pressure was 200/110. Luckily, her daughter insisted on checking it. Takeaway: if you notice even one suspicious symptom, get a blood pressure monitor and check pressure morning and evening. This isn't paranoia, it's care. Osteoarthritis and osteoporosis. It's not just getting old in the knees. You often hear, "My joints just ache, it's my age." But in reality, it could be osteoarthritis, and that's a diagnosis, not an excuse. Osteoarthritis is when joints wear out, cartilage wears away, and bones start rubbing against each other. What does the person feel? Pain with movement, especially in the morning or after rest. Cracking or popping sounds in the knees, hips, or fingers. Stiffness, especially after sleeping or resting. Fatigue from walking long distances, even just around the house. Now add osteoporosis, and you have double trouble. Osteoporosis is when bones lose density. They become porous and fragile like styrofoam, and it can develop for years without pain. Then suddenly, someone bends over, lifts a pot, sneezes, and breaks a bone. Hip fractures are especially frightening. It's not just pain, it can confine a person to bed for a long time. Example: Arthur slipped in the bathroom and barely bumped himself. Seemed fine at first. 2 days later, swelling, pain, X-ray, a compression fracture of a vertebra, just because his bones were weakened. Takeaway: if joints are cracking and someone is afraid to climb stairs, don't delay. Get an X-ray, have blood tests for calcium and vitamin D. Add gentle exercises and bone-supporting nutrition. Diabetes: when sweets hurt even without sugar. Type 2. Diabetes is something that often stays silent for a long time. It creeps up slowly, unnoticed, and by the time symptoms are obvious, changes in the body are well underway. What to watch out for: constant thirst, even at night, frequent urination, dry skin, especially on hands and feet, unexplained fatigue feeling like your battery is draining, slow healing of cuts and scratches, itching in the genital area, sudden weight loss, or conversely, unexplained weight gain. Many think, "My sugar is fine, I don't eat candy." But it's not just about sweets, it's about how the body processes glucose. In seniors, insulin sensitivity often decreases, and the pancreas gets overworked and weakens. Example, Robert, age 67, lost 10 kilograms in 6 months. He was pleased about it, but then his blood pressure started dropping and he felt numbness in his fingers. The diagnosis, advanced type 2 diabetes. Takeaway, at least once a year, get your blood sugar and glycated hemoglobin tested. It's simple, it's quick. It could save your feet, kidneys, and eyesight. Alzheimer's disease. It's not just, I keep forgetting everything. We all forget things sometimes. Where we put our keys, where the remote is, why we walked into the kitchen. That's normal. But if forgetfulness becomes an everyday occurrence, it could be a warning sign. Alzheimer's is a brain disease that affects memory, thinking, and behaviour. It develops slowly, subtly, and at first it might just look like, well, that's just age, what do you expect? Symptoms to look out for. The person forgets recent events but remembers things clearly from 30 years ago, repeats the same questions several times in a row, doesn't recognise familiar places or gets lost on the way home, has trouble finding the right words in a normal conversation. Behaviour changes, irritability, withdrawal, suspicion. Example, Margaret started getting confused about the time of day. She might wake up at night and get dressed to go shopping. Seemed harmless enough. But one day she simply couldn't remember the name of a neighbour she'd known for 10 years. Takeaway, don't panic at the first sign. But if forgetfulness is interfering with daily life, it's a reason to see a neurologist. At early stages, there are medications and programs that can slow the disease's progression. Stroke. It doesn't ask if you're ready. A stroke is an acute disruption of blood circulation in the brain. Simply put, blood stops flowing to a certain part of the brain and functions start to shut down. Important, a stroke can happen suddenly, without warning, but often it gives signals. It's crucial not to miss them. Here are those signals. Sudden numbness in an arm, leg, or half of the face. Speech becomes slurred as if the person is drunk. Coordination is impaired, making it hard to hold objects. One eye doesn't see, or vision is double. Dizziness, weakness, loss of consciousness. There's a simple test. Ask the person to smile, raise both arms, and say a simple sentence. If they can't do one of these 3 things, call 911 or your local emergency number immediately. The faster you react, the greater the chance of recovery. Example, Walter started speaking with slurred words, mush in his mouth, and dropped his spoon. His son thought he was just tired, but his 12-year-old grandson recognised the stroke symptoms and called an ambulance. Within an hour, Walter was in the ICU. Takeaway, if you suspect a stroke, don't wait for it to pass. Every minute determines whether the person will be able to walk and talk or not. COPD. It's not just a little cough because of the weather. COPD stands for chronic obstructive pulmonary disease. It sounds serious, and yes, it is genuinely dangerous. It's often confused with lingering cold symptoms or chronic bronchitis, especially in those who used to smoke, even if they quit 20 years ago. What to pay attention to: a persistent cough with mucus, especially in the mornings, shortness of breath even with minimal exertion, feeling unable to catch your breath even at rest, wheezing, rattling sounds in the chest, frequent colds and prolonged bronchitis episodes. Example, Beatrice stopped walking to the store. She said she was too tired. In reality, she simply couldn't breathe when she climbed the stairs. She thought her heart was acting up, but it turned out to be COPD. Takeaway, if a cough lasts more than a month, it's not something to ignore. Get a spirometry test and see a pulmonologist. COPD can be managed in its early stages. Depression. It can hide as tired of life. In elderly people, depression doesn't always show up as crying and sadness. It's quiet, passive, often unnoticed, and family members often perceive it as just becoming grumpy or tired of everything. Here's what to pay attention to. The person withdraws, doesn't want to socialise, has lost interest in favourite activities, says things like, life is over, or everything is pointless, has disturbed sleep, loss of appetite, and weight loss. May complain of pain, but doctors find nothing physical. Example, George started staring into space in the evenings. He stopped calling his grandchildren, didn't go for walks, and wouldn't even turn on the TV. He slept all the time. Nobody thought it was depression until he said he didn't see the point in waking up. Takeaway: if your loved one seems different, don't ignore it. Talk to them, or better yet, see a therapist. Depression is common in people over 60 and requires help just like any physical illness. Here's the main point. These illnesses rarely come alone. Often, hypertension, diabetes, and depression develop simultaneously, and each one makes the others worse. Fatigue? It could be a symptom of blood pressure issues, diabetes, or depression. It's like a puzzle where it's important to see the whole picture. And unfortunately, because symptoms overlap, doctors might start treating the wrong thing. But it could all be different if the conversation started in time. Don't ignore even the little things, because sometimes these little things are the first thread that can pull a person out of trouble. Old age isn't weakness, it's experience. But even experienced people need help. Today, you learned about 7 illnesses to watch out for if you're caring for the elderly. Thanks for watching until the end. If this video was helpful, support us with a like and a subscription. Now tell us in the comments, have you encountered such signs in your loved ones? What did you do to help them?